Hello, I'm Mona Harbi, and welcome to our final episode of MS Talks Keep Moving Forward. Today, we will be focusing on how to live and manage life with MS. What many people don't realize that MS has a higher prevalence in women than in men. Today, we will also explore why that is, but also why you shouldn't shy away from living normally with MS. My final guest here today is Dr. Bassem Yamout. Dr. Yamout is currently a professor of neurology at the American University of Beirut Medical Center and director of the Neurology Institute and MS Center in Abu Dhabi. He is currently the principal investigator on several ongoing international MS research trials. Dr. Yamout, what are the current concepts used to treat MS?
This is a very important question because what we aim at is really stopping the disease completely. And nowadays, we really have the armamentarium or the drugs and the treatments to do it. So the basic concept is in treating MS is achieving no evidence of disease activity, which means no relapses, no disability progression, and no even new lesions on MRI. You know that we do brain MRI every period. So we want to have complete control of the disease with our current therapies. And if we are not achieving that, then we should escalate our treatment to a more efficient drug until we achieve what we call NIDA, no evidence of disease activity.
So, what do you think we should do to shut down the activity of the disease?
The most important thing in starting the treatment of a new MS patient is really to evaluate the state of that patient. And we have had many studies that have showed that from the beginning, from the first time the patient comes into your clinic, you can decide about his or her prognosis. Are they going to have a benign course or are they going to have a severe aggressive course? And there are many criteria, including the severity of the attack, the frequency of the attacks, the number of lesions on the brain MRI, the extent of recovery from the attack. So you put all of these together and you decide if this patient is going to have a mild course or a severe course. Based on this initial evaluation, you decide on your treatment. You can either use low, moderate efficacy medications if the patient is going to have a benign course, or if you think it's going to be a rapidly evolving aggressive course, then we start with the high efficacy medications. So this is the basic concept of what we do. Once we start any treatment, the second concept is that if the patient shows any evidence of new activity on treatment, which means new relapses, or his disability has progressed, or even if he has no symptoms at all, but develops new lesions on the brain MRI, in that case, and this is the second most important concept, the treatment has to be changed. We have to escalate. So this is how to manage the patient to ultimately, as I mentioned, achieve that this disease is completely under control.
And doctor, many research and statistics showed that women are having MS more than men. What can you tell us about this and what's the recent data around this area?
Right, this is absolutely true. In almost all of the studies all around the world, both in the West, in North America and Europe, and in the East, the prevalence is around 2 to 1. So 2/3 of the patients are women and 1/3 are men. And actually, we did our own study through Minactrims in the MENA region, Middle East, North Africa region, and we reached the same conclusion. Around 67 to 70% of our patients in the Middle East, North Africa region are women. The reason is that it's an autoimmune disorder, which means it's the immune system of the body that gets deranged and start attacking the brain and the spinal cord. And we know that almost all autoimmune disorders like arthritis, asthma, lupus, all of them are more prevalent in women. The immune system in women is different from man, and probably this is related to the fact that the woman get pregnant and conceive a foreign body, which is the baby. And during pregnancy, there is a complete immunosuppression of the immune system to allow the baby to survive, not to be rejected as a foreign body. So the immune system of the woman is different from the male. And we think that this is probably the reason why all autoimmune disorders are more common in women.
Speaking about that, what can you tell us about pregnancy and breastfeeding? And if like women MS patients are listening to us right now, if they're thinking of getting married, what can you tell us about it?
It's very simple. Women with MS can do anything. They can get married, they can have as many children as they don't have. There are no restrictions. Now, this old concept from probably around the 80s and the 90s, before we had all these new effective therapies, was that if women with MS get pregnant, they might get worse. So they used to avoid pregnancy. Nowadays, this is not the case at all. We have enough treatments, we have enough knowledge, we have enough science to be able to control all the disease activity before pregnancy, during pregnancy, and in the risk period, the first 3 to 6 months after delivery, which is the highest risk for relapses. So we have many treatments and many approaches really to control this completely. So my advice to women, just behave normally as if you don't have MS. You can get married, get pregnant, deliver, irrespective of number of children. Actually, some studies have shown recently that the higher the number of pregnancies in women, the less severe is the disease. So actually, it might have some protective effects.
That's good to hear.
Yeah.
So what can you tell us over the last 10 years, like if what happened to the treatments in MS and the development of the treatments in the last 10 years?
We had tremendous advances in MS over the last 10 to 25 years. Now, as you know, MS was first described at the end of the 19th century by Professor Charcot in Paris, in La Salpêtrière. So we had 100 years until the early 90s of the last century when we did not have any treatment. And then the early 90s, which is only like 25 years ago, we had the interferons, the first treatment. And nowadays we have almost 20 treatments. So over the last 25 years, treatment in MS has advanced so much that I think it's the most rapidly evolving therapeutic area in all of neurology, even faster than Alzheimer or stroke or Parkinson. What did we achieve with these advances? We achieved a lot. I'll mention a very nice study that was done in an MS center in northern Italy by Professor Sormani. She looked at all her patients in the 80s before treatments, and she found out that by the age of 50, 40% of the patients were using a cane to walk. Then at the end of the 90s, with just the interferons alone that are advanced, at the age of 50, only 25% of the patients were using a cane. And after 2010, when we had all these new high efficacy medication, less than 5% of the patients were using a cane by the age of 50. So it's a tremendous improvement of the last 25 years, which we are very proud of, and which MS patients all over the world are really feeling it, that we are changing the natural course of the disease.
So with that said, what do you see in the future for treatments for MS and controlling and managing the symptoms?
I see more advances, more treatments. Now, we still have a gap in our treatment of MS. We are very good now at controlling the disease, the inflammation, the relapses. However, once the patient gets into the secondary progressive phase, which we call secondary progressive MS, this is where we still lack some treatment that are effective. We have currently 2 treatments, but they are still not enough. The main concept now of treatment is to control the disease very early on to prevent the patient from going into this progressive phase, and we have been successful, delaying it by 10 to 15 years even. But once they get into that phase, what we call the progressive phase, this is where most of the research in the next 10 years is going to concentrate to try to find effective therapies to prevent the progression of disability during the progressive phase. So this is where I see most of the research in MS in the future.
Are there any lifestyle change someone can make so they can live normally?
Absolutely. There has been many studies to assess if there are any environmental factors that worsen MS. And every single MS patient asks me, what should I do on my own, beside treatment, to avoid the progression of MS? And from all of those studies, there has been few factors that were identified that can affect MS. Number 1, smoking. Every single study has shown that people that smoke have a higher risk of developing MS. And once they have MS, they have a higher risk of having a more progressive disease. So patients should avoid smoking at any cost. The second point that was discovered through scientific research is that vitamin D deficiency can affect MS and lead to more relapses and progressions. So patients should check their vitamin D, and almost all patients should be on vitamin D replacement. There have been many other factors identified but we cannot control, like getting certain viral infections during childhood or adolescence, but these are not under our control. Now, once it comes to lifestyle changes also, exercise has been shown to actually change the course of the disease. It's not just keeping healthy. It has been shown that people that have regular exercise actually delay disability and decrease the number of relapses. So actually, it's actually therapeutic. So I do advise every MS patient to have a regular exercise protocol. Now, there are certain symptoms that will need some lifestyle changes in MS. One of them is, for example, fatigue. Now, fatigue is a typical symptom of MS, whereby the patient would feel that after a few minutes of work, they get fatigued quickly. So one way to deal with the fatigue is, number one, we have certain medications that we give to treat fatigue. Number two, the patients can change their lifestyles by doing short periods of chores, not very long ones, and dividing the chore during the day for short periods. So relaxing and resting in between. The other thing that can increase this fatigue, and I'm sure you know, Mona, and everybody knows, is the heat, high temperature. Because in high temperature, the symptom of MS are felt more. But this does not mean that there is more damage, just a feeling. So if you go back to a cold area in AC, the symptom will disappear. So avoiding being in very hot areas also can help as a lifestyle change to avoid these symptoms.
So to recap what Dr. Bassem said, for MS patients, you can be fully functional and living a normal life. Just you need to avoid the things that can worsen the symptoms, like heat and smoking and feeling fatigue. Pay attention to yourself when you feel fatigue and give yourself a rest. And other than that, you can be functioning normally and living normal, just like Dr. Bassem said. Thank you so much, Dr. Bassem. You have achieved some incredible results, and I really appreciate your time with us and all the information you provided. Thank you so much.